It is my pleasure to introduce you to today's presenter, Susan Mitchell. Susan is a veterinarian social worker with more than a decade of experience in the veterinary medicine, including 12 years of veterinarian technician. She earned her Master's of Science in Social Work from the University of Tennessee with a focus in veterinary social work from social work, and now serves with NOMV. Through NOMV's Clear Blueprint, Susan works with veterinarian teams to build healthier workplace cultures by strengthening communication, well-being, leadership, and psychological safety. Today, she'll share practice strategies for creating safer, healthier, and more resilient veterinarian teams by leading with well-being. Susan, thank you so much for being here with us today. The floor is yours.
Thank you so much. And a big thank you to Cubex for organizing this and providing the platform to bring this CE to life. It's been a joy working with them, and I'm excited to talk about an aspect of veterinary medicine that I'm pretty passionate about. I hope it will be interesting for all of you. I'm going to go ahead and get started by sharing my screen so that you are able to see my slides. Okay, so a culture of clinic well-being and safety. What we'll be learning about today, I'll welcome you to the presentation, give you a little bit of background about myself. Thankfully, we've already covered some of it. And then we're going to have an overview of what the current state of well-being in the veterinary profession is. I know it's kind of one of those things that's ever changing, and it's sometimes a little hard to get the pulse of exactly where things are. But I'm imagining that if you're in attendance of this particular CE, you already recognize and have some background information about how there are unique stressors to the veterinary profession that can lead to, some negative well-being outcomes if we aren't prepared to make sure that we're taking care of ourselves. So we'll talk a little bit about where things are at. We'll also talk about the link between veterinary medicine and substance abuse, especially in relation to controlled drug access. And also then we'll talk about what we can do about this, what actions we can take in order to help, prevent those poor outcomes, to help take care of our veterinary professionals and make sure that they're having, healthy and productive careers, as well as, healthy lives outside of work. So we've covered a lot of this already, but just a little bit about myself. Like Yasmin said, I was a veterinary technician for about 10 years on the floor. I still have my license, so about 12 years total, although I'm not in a clinical setting quite as often anymore. And so I really got to experience firsthand what it was like to feel those stressors. I personally experienced pretty severe burnout during COVID, as many of us did, and that got me motivated to look into other types of veterinary careers. And I was certainly very interested in mental health. And so that kind of pushed me into pursuing veterinary social work. And that kind of led me to Not One More Vet. I had been aware of the organization for years, had always really valued their commitment to helping and supporting veterinary professionals. So I was very excited to be able to sign on with them and be one of those people providing that support. And just, for cuteness tax, I've got pictures of my pets here. So in this first section here, we're going to kind of go over what we're seeing, what trends we're seeing in the veterinary profession, what the landscape looks like today. I feel like I first started really hearing about and noticing other people paying attention to mental well-being maybe 7 or 8 years ago. And the first thing that kind of came out was especially about how difficult veterinary medicine could be on your well-being. And now we've been able to, get some good data as to like exactly what's going on, figure out what the root causes are, and move into a space where we're actually looking to prevent poor well-being outcomes and provide better support. So with that, we're also going to look at how organizational and occupational factors factor in. It's not simply that the job is stressful and we need to take better care of ourselves on an individual basis. It also has to do with, how our workplace functions and whether we're providing a workplace that allows for good mental health and good well-being. And we'll also touch a little bit on how, having good well-being on staff influences the organization overall. It influences how the team is functioning and also how we're able to hold on to employees and things like that. So we'll kind of dive right in with just kind of a broad state of well-being. The CDC actually recognizes mental health as one of the primary hazards to veterinary professionals. So as they're looking at the types of job hazards there are, and they're talking about radiation from taking lots of x-rays, and they're talking about, the risk for injury from getting bit by an animal and things like that, they are also listing that mental health is one of those hazards and something that we should be considering when we talk about safety and take just as seriously as we would those sort of more physical hazards. And I'm probably preaching to the choir here, but certainly there are a wide variety of challenges that can cause stress and poor well-being for veterinary professionals. Some of the things that we look at include, burnout, compassion fatigue, moral injury, and we certainly see high rates of burnout as well as increased rates of mental health issues and substance abuse or misuse. There is a lot of, struggles mental health wise that then can lead to unhealthy coping mechanisms. And that's something that we're hoping we can address better and provide more healthy coping mechanisms so people aren't, leaning on medications or alcohol or something like that. And we've got a few little charts here. On the left-hand side, we've got our rates of burnout. On top, it's the veterinarians, and the lower circle is our staff members. Orange is high levels of burnout, and the sort of teal color is moderate, and at the bottom with low is that like dark teal color. And as you can see, there's a significant number of veterinarians that are experiencing burnout, but it's especially high in our veterinary staff members. So our technicians and our client representatives and roles like that are experiencing really high levels of burnout. And as veterinary professionals described their own well-being in a study done by Merck, they found that there was more veterinarians that felt that they were in a state of suffering, but there was also more veterinarians that felt like they were flourishing, whereas our staff, the great majority there is seeing that they are sort of in that getting by sort of mentality where, they're not in crisis, but they definitely don't feel like they're doing as well as they'd like to do. And that's something that we want to see to start to shift, where more and more professionals are able to flourish and we're not seeing such high rates of burnout. As far as the types of stressors that have been studied, like I said, there's many of them. We certainly see some that are related directly to the individual with their personal demographics, whether that's socioeconomic or their culture or identity. Some of this also has been shown to be related to personality, where the type of individuals that are attracted to veterinary medicine also happen to be individuals that are a little bit more on the neurotic side of the spectrum and maybe a little bit more prone to things like anxiety. A major stressor, the one that everyone in the general population thinks of when they think of what's stressful about veterinary medicine, but it certainly is a stressor, is euthanasia at any volume. This can be especially difficult for some of our large animal vets or some that are working in sheltering where there's really high rates of euthanasia, and they're kind of having to deal with that day in, day out. And then, kind of along with that, it makes it hard to leave things at work when your entire workday can be so stressful and you're dealing with these issues that are, pretty devastating. And it can lead to some poor work-life balance for people. One of the main contributors to poor work-life balance was cited to be on-call shifts. Having to regularly be on call was documented to make it very difficult for people to disconnect and enjoy their downtime. It took the stress of work and brought it into the rest of their life and was a huge contributor to stress ultimately. Of course, like any workplace, a lot of veterinary workplaces are also going to have interpersonal conflicts. We are human. We're not perfect. We don't communicate perfectly, whether it's with clients or with other colleagues and coworkers. That can always be a source of stress. And something that we're noticing more and more, not just in veterinary medicine, but certainly it has cropped up in veterinary medicine, is when upset clients take to the internet or take to social media as a means of expressing their frustration, and how much of an impact that can have on the professionals that were trying to help them, and the challenges with that sort of cyber harassment is a new thing, relatively new thing, and something that we are seeing more and more of. We also certainly, as veterinary professionals, experience moral injury. Here we're defining that as kind of like a misalignment between responsibility and values, but it can look like a lot of different things, whether it is, having to perform a euthanasia of a physically healthy pet because of behavioral issues and that misaligning with your values, or on the other end of the spectrum, having a client that wants to continue with treatment, even though it's not helping the animal feel any better and it's not going to, help the animal get healthy again. It's simply prolonging their life and causing pain. And that sort of futile care that some clients are asking us to do can certainly, really eat away at how we view ourselves. Along with a lot of other professions, there is certainly financial stress. This has gotten significant for new vets with the cost of education and the student loan burden that they come out of school with. It also hits our staff pretty hard with, the economy and the way that it is, and some stagnant wages, and trying to figure out how to make do with less, and always having to kind of worry about stress or worry about finances outside of, their day to day. It gets to be a lot. And there will always be some occupational safety aspects. These are things that I think we've had a little bit more time and experience to develop expertise in how to mitigate. Certainly, I know that, safety with radiology has improved significantly since the days that I started. It was not unusual for us to not wear our gloves or to just snap a quick x-ray without having our gown on or something like that. And now we have learned better methods, found better ways to reduce the amount of exposure that we're having to certain hazards, gotten better about how we manage zoonotic diseases so that we're lowering the risk there. And especially, injury in relation to working with animals. We have things like fear-free that help us kind of get on the animal's level and reduce that likelihood. I think we're much more willing to reach for pharmaceutical restraint these days than we were a decade ago. And that has, helped us to prevent injuries and also, help the animals to have a better time and to be a little bit calmer and less stressed. And something that I consider to be sometimes, a source of stress, but can also certainly be a protective factor is kind of how the workplace is organized and how supportive it is. So whether the workplace is able to provide that supportive environment can make a huge difference on an individual's stress levels. Some of the things that often come up, but we have found through studies that they don't seem to have a major impact on the source of stress for veterinarians and veterinary professionals is whether the workplace is in a rural versus an urban environment, or if it is a clinical versus non-clinical environment. So that's to say that our research veterinary professionals are having just as hard of a time as those who are directly providing care. And it is, these stresses kind of do go across the entire industry. They're not specifically only held in certain pockets, and all veterinary professionals need support. The exact supports they need may vary from workplace to workplace, but there isn't some, rainbow job in veterinary medicine that has no stress whatsoever. So that was a lot of stressors to talk about. I'm sure you could probably also add a few of your own to that list. But what we see is the combination of all of those stressors really do contribute to negative outcomes. We see high turnover rates. We see it being a high cost to the business itself. And then, of course, we're also seeing high rates of depression and anxiety and substance abuse or misuse among professionals. One study found that nearly a third of veterinary staff expect to leave their job within the next 2 years. And, that really showcases the turnover rate and all the stresses that go along with high levels of turnover, all the extra training you have to do, and the kind of constant introduction and exit of personalities into the work group, and how that can be challenging. And it does actually cost the business a lot of money, whether it is from burnout and the repercussions of that, which can include, decreased engagement, poor performance, taking more sick days or having to take leaves of absence. That can cost a workplace thousands of dollars a year for each employee that's feeling burnout. And if you'll remember from our slide previously, that half of the staff was feeling burnout and a good third of the veterinarians were also feeling burnout. So burnout can certainly decimate a business if they're not able to manage it. And at that end, the estimated total cost of burnout for the industry is in the billions. Getting a little bit into the substance use and controlled drug access as far as mental health risk, we're going to describe the relationship between how the occupational stress relates to the substance use and the mental health risks. We're also going to explain how access to controlled substances can increase suicide risk and why limiting access can be a really important step for prevention. So to start, studies have shown that veterinary professionals do indeed struggle with alcohol and substance abuse at rates higher than the general population. They found that opioid and benzodiazepine use disorders among medical professionals in general, so human med and vet med are especially high, up to 5 times the rate of the general population. And some of that certainly has to do with the ability to access those medications. And then unfortunately, we find that veterinary professionals are still reluctant to seek help, especially with substance use due to the stigma, but also the fears of the negative career outcomes. There's kind of an ongoing theme with a lot of veterinary professionals, but especially the veterinarians, of feeling like because they have already devoted so much of their life to schooling and invested so much into their career, they don't want to do anything that might mess up their career. And so there's a strong fear of, if I admit to the fact that I'm having an issue with substances or alcohol, that I might get fired. It might really screw up my career. Taking time off might really screw up my career. And so they're reluctant to actually talk about it or to seek out help. And part of the formula is certainly the fact that they have access to controlled drugs. It is essential that we have those medications for the animals that we're treating in order to practice the highest level of medicine. We do need to make use of those medications. And when they're used correctly, they can be, really valuable and life-saving interventions. It's when, we end up, taking those for ourselves or misusing them. That's when we start to see trouble. So there was a survey of American veterinarians that was looking at, drug use and misuse in the veterinary field, and 73% of American veterinarians suspected that a colleague had at some point had some sort of substance use or misuse. That's a really high number. I don't think you'd be able to say that about, any other profession outside of medical professions. And, this was an impression. It wasn't, an exact, we know that 73% of people have misused or something, but the fact that so many people are aware of the fact that people have maybe been misusing or suspect that people have, that's a really high number and really telling about how deep the problem goes in the industry. The AVMA found that 11 to 13% of veterinarians are substance abusers, which is higher not only than the general population, but also higher than other types of medical professionals. So certainly we're finding that, with the access and combined with the unique stressors of veterinary medicine, the professionals are at risk of developing these disorders, using medications inappropriately as a coping mechanism. And there has also been a link found between medication storage and both suicide and even between how the medication is stored and how the professional feels about their suicidal ideation. When the medications are readily accessible, the professionals report that they are, feeling more likely that they will actually follow through, more likely that they could actually complete suicide. And so there is certainly a psychological aspect as well to knowing how well and safe we're keeping our medications. On that note, poisonings account for nearly half of veterinary suicides. And what we find in the general population is that a little more than half of suicides are gun-related, at least in America. And we often find that men are more likely to use a gun than women, and therefore they're a little bit more likely to complete suicide, whereas females tend to have more attempts, and they tend to prefer methods including poisonings and things like that. What we see in vet med is that as far as the men go, it still is about half that choose to use a gun, and about a third, 32%, that choose poisoning. But what we're seeing is that among females, 64% are using poisonings, and they're completing suicide at a higher rate than females in the general population because they have an understanding of how the medications work and exactly how to administer them to make sure that they're successful. I found it very telling. One study, when doing their, like running all their numbers, they found that if they excluded all of the deaths by suicide that veterinarians had used pentobarbital, or what we mostly know as euthanol, were excluded from the analysis, the suicide rates were actually very similar to the general public instead of being so much higher than the general public. And I think that really just does speak to how much having access to these medications as well as understanding these medications can contribute to that type of an outcome. But it's not all dreary. We have had, a decade plus to start to really learn about the stressors and how we can go about trying to mitigate them and improve systems and make things a little bit better and find the right supports for professionals. So we're going to talk a little bit here about how to provide organizational well-being. And specifically, we'll talk about Not One More Vet's Clear Blueprint program. That is a organizational level intervention that practices or workplaces can take in order to help support their employees better. We're also going to talk about controlled substance management solutions and how QBEX is helping us with keeping our veterinary professionals safe. So what the studies have found is that there are certain things that seem to work. One of the most important is reestablishing that work-life boundary. And that includes things like adopting a different on-call system, or if possible, getting rid of the on-call system, making it more predictable. But we also need to be making sure that the workplace is a psychologically safe workplace. And that requires some learning for a lot of people. We need to go in with cultural humility. We need to start to embrace the emotional aspects of the job within the organization and have conversations about how people are feeling, whether that's, rounding after a particularly difficult case, having a conversation after dealing with a particularly difficult client, and also just being allowed, breaking down that stigma around taking care of oneself, being able to practice our healthy coping mechanisms freely, and also making sure that we are practicing good drug safety and making sure that we're providing a support there as well and protection. Certainly, material support is always helpful for well-being. Struggling financially is a stressor regardless of your profession. So looking into the ways in which that we can provide that material support is helpful and useful. And then also developing some positive psychology and bringing that into the workplace, whether that's educating staff about it or making it into part of the routine or the habits. Those are the types of things that we're finding in the studies to be helpful and make a meaningful impact. And with that, NOMV decided to create a practice certification. Prior to Clear Blueprint, NOMV had primarily devoted a lot of its supports to the individual level. And a lot of the industry was also focused on the individual and, what the individual could do to help themselves. And that is a very important key component in well-being, but it does not matter how much therapy you go to or how much self-care you practice. If you are going into a toxic or stressful work environment day in and day out, you're going to still be at risk of having negative outcomes. So we wanted to find kind of that organizational niche as to how we could also provide support in its development. We used a multidisciplinary group. We had veterinary professionals and mental health professionals, of course, but we also included voices from business professionals and legal professionals, making sure that we were kind of viewing well-being from all different angles, and also making an efficacious program that was going to be able to be implemented and going to be helpful. We wanted the program to be something that could reach every veterinary professional, regardless of their workplace. So the program itself is made to be scalable for small workplaces as well as large. I think our smallest clinic that we've worked with has been about 3 staff members, and our largest was over 300. And along with that, also something that could be applied in a lot of different types of veterinary workplaces. Of course, it's designed to work in a general practice clinic, but it is also something that works in a large specialty and referral hospital or a university hospital, a research facility. We've even had some veterinary technology companies coming in and utilizing the program to help with their workplaces, animal shelters and rescues, things like that. As well as, of course, like our large animal vets and our mobile vets, even relief vets, have been able to participate and learn and benefit from the program. The program is really meant to empower teams to implement changes that are going to help them create a really healthy culture and prioritize staff well-being. And so with that, it is a program that can be tailored pretty easily to service any veterinary workplace. I hope it goes without saying that this is for the entire staff, not just the veterinarians, but the vet techs and the CSRs and the kennel staff sweeping up in the back and everyone that is working in that workplace. I kind of went over this already, but just to reiterate, we were looking to provide support at that organizational level so that all of those things that we're doing at an individual level have a chance to actually work and be beneficial. And the program is meant to be a proactive one. It does certainly also help clinics that are coming in saying, hey, we're really struggling and we need to kind of, react to this and change some things. But the program is designed to then kind of allow them to transition into a proactive place where they go from reacting to problems that are coming up, getting those under control, and then being able to maintain those things and to set themselves up well for the future and be able to really have great culture and anticipate stressors and anticipate how to deal with them. It is all kind of based on a strengths-based assessment. So what we're really looking for is to leverage what strengths the group already has and use those to kind of make improvements. It's very data forward, and we provide a lot of coaching as far as, how to take that data and turn it into something useful and help you kind of figure out how to make your workplace better. So briefly, the steps for the program, we first identify what we call them a clinic advocate. This is our liaison between NOMV and the workplace. They kind of just provide most of the communication, and we select a start date to do an assessment. The assessment itself is relatively brief. We did a lot of beta testing to make sure that we were asking for the information in a really concise way, an efficient way. And what's most important to us is that we get a large proportion of the staff participating. We require at least 80% of the staff to return the initial assessment before we can move on. And that's because we want to see how the staff is feeling, rather than how a small portion of the staff is reporting how things are going. We want a representative sample so that we can make sure that as we're making recommendations, there's something that's going to help the entire staff rather than just a few people. The Clear Blueprint staff parses all the responses from the assessment and offers a meeting that we call a roadmap meeting that goes through everything that we found, all the trends that we found in the data, what strengths we were able to identify, what areas seem to be challenging, and we make some recommendations at that point as far as what we think would make sense to focus on and prioritize, and then we open up our educational content for the clinic and all of those resources. We've developed essentially, it looks like kind of like an online textbook with 10 different chapters, and each chapter is devoted to an area that could either be a contributor to stress, or if done well, could actually be protective against stress. And each of those chapters kind of tells the clinics and gives them resources on how to go from being stressed to being protective, and using and creating strength in that area. And as it is a certification program, they can use those resources to work towards their certification and use additional assessments to track their progress as they work towards that. What we are finding with the program is really positive. It is a relatively young program, but we are already seeing some pretty striking results. We've found that clinics that have gone through the whole process through to achieving certification report that they have much better feelings about their client interactions. We're also seeing a 13% drop in feelings of burnout, which really makes me happy because that hits so close to home for me, having experienced that myself. And we're also seeing fewer incidents of moral injury, especially in relation to caseload management. Our certified clinics are also reporting that they're having more positive interpersonal relationships, and they're also feeling more connected to their community and to their mission. And to us, that really says that they're feeling more connected to why they got into veterinary medicine in the first place. If anyone is interested in learning more about the program, I'll leave this QR code up for a few seconds and you can snap a picture of it. We're always happy to jump on a video call and kind of talk you through the program and see if it's something that you would be interested in for your own workplace. You can also always reach out through our website. And now I'll introduce Janelle. She is going to be talking to you a little bit about Cubex and the connection there.
Thanks so much, Susie. That was wonderful. I'm Janelle. I have had a similar experience as Susie, where eventually being in the clinic setting led me to a lot of burnout, and eventually kind of looked into a different route to take all of my knowledge. Essentially what Cubex does is we can help kind of streamline some of the processes that come with those controlled substances, as well as your inventory. So when you're thinking about the burnout that happens, even in just the small things, when things are missing, you don't have enough of those things, or potentially just keeping up on those logs at the end of the day when you've already been pretty, stressed out all day. So we can definitely help with that. If you're somebody who's interested on kind of just having a conversation with us and seeing if there is a way to maybe make your life a little bit easier, you can go ahead and scan that QR code there, and we'd be looking forward to talking with you.
Thank you, Janelle. So now we're open for questions, and I was just looking to see if there's any questions here in the chat or in the Q&A, and we don't have any so far, but let's give everybody a couple seconds to see if we can come up with some solid questions here for Susie. I mean, Susie, you did a great job in providing all this information, so maybe that's why. Oh, we have one. Yay. Okay. How do you actually motivate staff to participate? I've tried implementing a lot of recommendations and our staff just doesn't want to participate.
This is a really great question, and it's something that we talk about a lot with the program. Sometimes it can be very difficult to get staff buy-in. Some of it is a matter of making sure that you are appealing to what will motivate them. That we're able to kind of figure out a bit with the assessment. Sometimes clinics are very surprised at the scores in their assessments and surprised to see where the staff is feeling the stress, because every person does experience the workplace a little bit differently. So first, kind of pinpointing exactly what stressors they're feeling, what's going to motivate them. And then we've found that involving the staff can also be a really big motivating factor. If they feel like they've got some autonomy or even some leadership as part of the process. I've had clinics that have made it into a bit of an assignment where each staff member is responsible for, presenting some ideas or presenting some information from the resources. And having that kind of accountability can, almost kind of force them to be a little bit more accountable to and a little bit more open to the things that you're trying to change, if they feel like they were a part of determining the change.
Thank you, Susie. Is there any? Oh, we have one more. We have an EAP program at our hospital that offers free counseling sessions, but I find that there is a hesitation from people to use it. How can you encourage people to seek help?
I think this is pretty common. We find that sometimes it's a awareness. Sometimes people hear about the EAP when they get hired on and then they never think about it again. And when they're going through a stressful period, it just doesn't occur to them. So having some reminders out there, whether it's, some signage in the hospital or just regular email reminding them of their entire benefits package. It is pretty amazing how unaware some people are of their total compensation package and are focused just on, what they're getting paid. If you've got that knowledge piece down where they do know about their EAP, the next kind of hurdle is oftentimes the stigma around seeking help. And this is where we find kind of incorporating positive coping mechanisms into the day-to-day can be helpful when they have people, especially people in leadership position, demonstrating their own positive coping mechanisms and openly talking about how they're taking steps for their mental health. That helps to kind of break down some of the stigma that they may be feeling or reluctance to seeking help themselves.
Thank you. I wanted just to weigh in really quick on this for EAP, because in my previous life, we also had this available. And sometimes it was just not knowing what the process was and how simple it is to make the call, get approved, and then that they're protected, it's confidential. That also probably would help to know. We have one more. Do you have any recommendations on how to find EAP programs like that for smaller hospitals?
We don't have any like specific recommendations as far as which one's the best or which one to go with. I know that for smaller organizations, and NOMV being a relatively small organization itself, sometimes you can find kind of I think they call it like a group. I'm blanking on the word for it, but like you get together with several other small businesses,
Support group?
and you're able to like negotiate for benefits on that scale, and it can help you with everything from getting better health insurance for your employees to being able to look at things like an EAP. I do also recommend that if you're having any trouble with this, look into your state and local veterinary groups. A lot of them will have what they call a VAP, or a veterinary assistance program. So your state may also offer it outside of employment, just as something that the veterinary board in your state offers.
We have a couple comments. Just as a veterinarian social worker, I go over it during the onboarding process. And then VMG was noted. Thank you, Susie, for sharing your expertise and practical insights with us today. Want to thank on behalf of QBEX and Not One More Vet, we want to thank everyone here for taking the time out of your busy schedules to join us today. And most importantly, thank you for everything you do to support your teams, your clients, your patients, and your veterinarian profession.